So, everybody, are you tired? Are you tired of COVID?
It strikes me that in family medicine, particularly where we integrate palliative care, communication is at the heart of that, and of revealing and bringing hope alongside our skilled clinical interventions, particularly with patients who we know have comorbidities, who may be elderly, who may have poor functional status, in which case, ideally, we're having these conversations before a diagnosis of COVID-19.
We empowered multiple levels, and we were ourselves empowered by those in management levels above us to make certain decisions within our scope of ability.
Suffering is more than the pain or the dyspnea. It is the dislocation. It is not understanding where it's going.
So one of the very difficult conversations I had with the family didn't focus on the clinical care at all. They recognized that mom had died in hospital. They wanted to know who sat with her, what was spoken about, the final conversation and the final comfort. And what gave them comfort was knowing that the nurses at 2 o'clock in the morning sat with their mom and prayed with her. And I think it's the things that we don't necessarily need to professionalize. It's more that we need to bring humanity into our professional lives. That's going to help us, help our patients.
I think if we don't get to hear the family concerns, if we don't get involved earlier enough as a palliative care team, we miss opportunities, we miss windows of conversations that need to happen between families.
Small things that we might as professional people regard as small things, but in real life they're not small.